So my name is Jayanti Adelman. I'm the Library Director for the Monterey County Free Libraries System. And I want to welcome you to the 6th in our series of our Community Matters Civil Discourse at the Library programs. This has been a very, very popular and successful series for us. Our mission is to bring ideas, inspiration, information, and enjoyment to the community. And so we've been really trying to do this where we bring the community in and talk about matters, about topics that are of great importance to everyone. And sometimes there are varying viewpoints, sometimes there are just many sides of it that we need to know. So this is a great opportunity, and I'm really glad NAMI decided that we were a good partner for them for this program. A couple of things. I hope all of you have signed in. That is important. You can use a fake name, whatever, we just do it. We do it for head count, so that is important for us. We also have little evaluation sheets that are on all the tables. So if you can please fill out an evaluation sheet at the end of the program, it really helps us plan, tells us what we're doing right, what we're doing wrong, and gives us ideas also for what to do in the future. And so with that, I know all of you are eager to hear about what our panelists are going to say. I'm going to turn it over to Bonnie Bumpkin.
Good evening, everybody. Hi. First of all, I want to say thank you to Jayanti. I want to thank you for starting community conversations. So, as NAMI, what we're really excited about doing is talking. And I know that sounds a little just strange, but starting to talk about suicide. We have got to break the silence. And so this is our first opportunity. And your beautiful chimes. That's wonderful, I love it. This is our first real go at just starting to talk and just starting to break the silence. Suicide is something that has lived in the shadows, and families have lived in the shadows, and people that have suffered and died by suicide have lived in the shadows. And it's time for, in our view at NAMI, people to get to live with dignity and people to get to die with dignity, and for their families to get to be held in dignity. So that is a lot of why we decided we wanted to do this tonight. After Anthony Bourdain and Kate Spade and Dr. David Soskin, who I know so many of us in this room knew, died by suicide recently, we knew it was time to talk. And NAMI is a grassroots organization, and what we do is our work is just to educate, primarily to educate, and through the education to decrease stigma. So the big deal with the people we hang out with at NAMI is like, we gotta pull the shame off this stuff. We've got to get people to the point where they're seen as human beings, they're seen as people managing conditions, and so that we're all in this together. You know, we are a community. I was kind of laughing to myself because I thought, wow, I'm really, really excited about a suicide panel. Wow, that's pretty ironic, isn't it? I've been so excited. And talking to all of these people that I've just now met, I felt like they were old friends and we're all on a team together, and I'm just meeting these people that we all have the same vision. So obviously if you're here, suicide has either impacted you, or you've suffered yourself, or you're just interested in a really hard topic. So I want to give you guys some statistics on suicide before we start in. Can you hear me okay? Okay. So what's going on in the States right now, you guys, is kind of scary. Between 1999 and 2016, the suicide rate has gone up 30%. That's just out of control. So in 2016, 45,000 people died by suicide. That's a ton of people. That's double the homicide deaths. And we're not talking about it. You turn on the news, you hear about the homicide deaths. You don't hear about the suicide deaths. So that number to me is staggering. It's also underreported, which I also find interesting. Men used to be quite a ways ahead of women in number of deaths by suicide. Ironically, the numbers are getting closer, not because men are doing it less, but because women are doing it more. That's also very disconcerting. It's terribly, terribly frightening. I read an interesting statistic the CDC put out that 57% of people that die by suicide don't have a mental health diagnosis. When I read this, I was like, that really shocked me. Well, I went on to finish the article, and upon autopsy, 90% of those people had mental health conditions that were not being treated. So that to me was just a huge wake-up call to how much people aren't getting the help they need. Suicide in rural areas is much higher than in urban areas, and that is suspected to be because of lack of access to mental health care. Also, there tends to be way out. Montana is the worst. Montana, their rate of suicide is over twice what the national average is. So there's a lot going on there. There are thoughts about access to guns, and guns is what the research is showing. So there's a lot of interesting statistics because most of the globe, the suicide rates are staying the same or they're decreasing, but in states they're going up. So some of the things that have thought to lead to this are the depression that we had 10 years ago, and that created so much financial instability that led to a lot of it. The opioid crisis is playing a big part in this. I have a very heavy adolescent practice. I'm a psychotherapist in Carmel, and I'm watching kids. It'll be very interesting to see in 5 and 10 years the effect of electronics, simply because it's breeding a lot of emptiness, because kids are looking outward into cyberspace for their value, not really having to build the richness of soul within themselves. So these are some things I just wanted to share with you guys that I thought you might find interesting. Like I said, our big priority is let's get everybody educated. Let's get everybody healed so that these statistics can change, because this isn't just a mental health issue, it's a public health issue. And I really like the thought that as AIDS awareness increased and as cancer awareness has increased, and so much that we're learning about wellness, just human wellness increases, the more we're educated and the more we see it as a public health issue, we can bring these numbers down, and we can bring them down big time. So even though tonight is a really heavy topic, I don't want you guys to leave here tonight heavy. I want you guys to leave here enlightened. I want you guys to leave here feeling like there's hope, and that there's joy, and that there's resources, and that there's wonderful faces and names that are all bodies and hearts and souls out here that can help support you, support your family members, support your friends. And as NAMI, we do a lot of different programs, you guys. We do peer-to-peer courses, we do family-to-family courses, we do courses that educate providers on mental health. We do faith-based courses where we go into churches and synagogues and faith-based communities and train them. It's been found that 1 in 4 people with mental health issues goes to their faith leader first. And those faith leaders do not feel equipped. So we go out and do that. So if there's anything that NAMI can do to serve you personally, to serve your faith community, to serve you as a provider, your family, if you're a consumer of mental health services, we're here. So after this presentation tonight on suicide, please let us know. And we're glad to help coordinate these educational opportunities, and they're all free to the public. So that's another really exciting part of what we do. Also, in having a lot of conversations with the panelists, we're kind of thinking we're going to take our show on the road after this one, and hopefully do a few more of these before year's end. September is Suicide Awareness Month, so we're going to pull something out of our hat then. The American Foundation for Suicide Prevention, they're here. They have a big event in November, and we're going to do something as well in December. We're going to do something down in Greenfield, and also in conjunction with Gianti and the Monterey libraries. So I just want to say something on a personal note before I close. One of my favorite things about NAMI is that our work is based on the lived human experience. This is an organization that is about the sharing of story, not to stay sick, but to get well, and the sharing of story to increase our connection as human beings. And so I love that part of NAMI because it just keeps it raw sometimes, and it keeps it really honest. And so there's going to be a Q&A after this, and I just want to let everyone know, feel free to share, feel free to ask any questions that come up for you. That's what we're all here for. And if you're not comfortable sharing, There are resources on the back table. Call us, reach out, email us. That's what we're here for. We want you to know how to access all of these resources and how to feel really comfortable getting in touch with them. So here's my one little personal thing before I introduce the panelists. So last year we started this faith-based initiative, right? And I learned this statistic that suicide is the third leading cause of death in 10-year-olds in America. 10-year-olds. 10-year-olds. Between 10-year-olds and 24-year-olds, it's the third leading cause of death. I have an 8-year-old niece, I have an 11-year-old nephew, 13-year-old niece. I have all these godkids. I'm kind of like the Pied Piper, I just let children, right? So I see the stat, I'm actually taking my name. And then the next stat is that it's the second leading cause of death in 15 to 24-year-olds. I have a 15-year-old son. And something in me went, enough, just enough. And I haven't personally been directly affected by suicide in my own life. I dealt with my own depression, very severe depression as a teenager, and had definitely had suicidal ideation. But I wouldn't say I had ever really flirted with suicide as a personal problem. And a couple of months after I learned these statistics, and this was rolling in my head, and the power, and what could we do to impact, and how could we as NAMI members make a difference? I landed in Dallas and pulled my phone out, like all good Americans do. Pulled my phone out and clicked on it, and there was my best friend from childhood, and her father had taken his life by firearm. And I've known him since I was 6. And I was sitting on this airplane with my mother, who had also known this man since I was 6. And I turned to my mother and I said, Terry Murphy has died by suicide. And it was just one of those moments. Just one of those moments. And so tonight for me, that's when I was standing here. I'm standing with my best friend Cassidy and her siblings who I've known since we were little, and this man, this sweet man who died because he's in so much pain, and all of his grandchildren. And so I just wanted to bring that in because I just want to honor them. I just want to honor them. So thank you all for coming, and thank you for listening to that. So with that, I'd like to move into introducing our panelists. Well, I really want to say thank you guys so much for coming. So the first person I want to introduce is Carlin. Is it Mamoli? Or is it Mamoli?
Sure.
Is it Mamoli?
Option B.
Is it
Yes.
Mamoli? Yeah. Should have asked you on the phone when I didn't. So Carly is actually the program director with the Suicide Prevention Service of the Central Coast. And so Suicide Prevention Service, it falls under Family Service Agency of the Central Coast, and she's actually based out of Santa Cruz. And she's going to talk a little bit more about that in just a minute. Our second panelist is Kat Moore, and she is a volunteer with the Crisis Text Line, which I did not know about the Crisis Text Line until Kat and I talked, and it is so cool. This is so innovative and so exciting. So one of the things when Kat and I are laughing, Kat's like, I got this off the phone, she's the kind of person that's parachuting into the war. Like, she is ground force woman. So, and she's incredibly passionate, and I'm very excited for her to share with you. She's also a part of a thing called Project Echo, which has hubs all over the world, and they're trying to create a lot of innovation in medical education and medical care delivery. And they're using a lot of telemedicine, though it's different than telemedicine, but it's a very cutting edge project that she's a part of. And I want to introduce Dawn McGahan. And Dawn is a local LCSW. And Dawn works for the VA locally. And she is a volunteer with the American Foundation for Suicide Prevention, otherwise known as AFSP. And she currently sits on their board at the greater San Francisco Bay, in that area chapter, right? She's also going to talk to us a little bit about how suicide awareness and the VA overlap a little bit. They're doing some neat things. And then Watchman Tigaron. And Watchman is, he's also a volunteer for ASFP, and he's an active member of their suicide grief and loss group, and that's going to be something he shares with you about tonight as well. The next gal is Dana Edgell. Not Edgell. You're next. You're next. You're next. I'm doing, they're out of order. Sorry. Actually, no, we'll start. Cheers. Okay, so this is Dana Edgell. So Dana Edgell, Dana is the prevention manager with the Monterey County Behavioral Health. So when I heard her job, I heard prevention manager. Oh my God, this woman's job is about how to help all of us do all of this great prevention work. So she's going to share with us a lot. The county has a lot to offer, and she has a really neat job, and so she's going to share that with us tonight. Then Dr. Renee Hill. This is Dr. Renee Hill, who is a local psychiatrist at a community hospital in the Monterey Peninsula. And Dr. Hill and I don't know each other very well, but we've collaborated care with her patients / my clients for a number of years. And I've always had a really positive experience. And when I was thinking about who I wanted to call for this, Dr. Hill was the first person that came to my mind. And the reason that she came to my mind is because I've always had an experience with Dr. Hill that was very authentic. And I figured she would probably be a very thoughtful person to sit and talk. So, and I've said to her recently that I hope to get to know her better because you've always stood out to me that way. So thank you for being here. Really appreciate it. And last but certainly not least is one of my dearest friends, Selena Glader. Selena and I became friends when we were training to become leaders for a NAMI provider training. And we walked in and it was like two old friends. It was like soul recognition. I walked in and we just knew each other. And I asked Selena to do this because Selena has had an incredibly interesting life. And we do a lot of trainings together. And what I've watched over the years, I watch groups of people listen to Selena and I watch how they light up. Selena has had a life that has been full of excruciating pain. The kind of pain that makes people want to leave the planet. She has also had a life of unbelievable beauty and joy. And somehow this woman still carries it all within her. And her story started very early, very serious bipolar I disorder. She was hospitalized very early as a child. Lots of very traumatic stuff happened. This woman has gone on to become a professional concert violinist, trained by one of the best in the world. She actually also, in her recovery, in her mental illness, became a mental health care counselor. And then I think one of the most beautiful twists of how life works, ended up a mental health counselor in the hospital where she was a patient as a child. So she got to literally go back and complete that. Her meds have never been right until her 50s, and now she's finally at a place where her healing is better. But she's just grace, and she's love, and there's no bitterness, and she just speaks from her heart. And I knew that tonight she would be able to share with us some of the depth of the pain, but also some of the beauty of the joy. So with that, hand over the panel. Carly, I'd love to, would you want to start? And if we could just move down this way. And with these, you need to push it all the way out. Here, I'll just leave this one.
We turn it off and off.
Just go all the way up. There you go.
Yes.
There we go. Okay, I was told to hold it like this. I don't fancy myself a pop singer. I was thinking, just as you were speaking about our last panelist tonight, and I'm so eager to hear the rest of you share what you have to, that when I first started out in this field, which was over a decade ago, the person who trained me said, one of the most important things is that we don't look at ourselves as being any different from the people on the other end of the line. Anybody can feel this way at any point in their lives. And while some people find that to be a frightening prospect, I think it really unites us. Sometimes we're in the helper car. Sometimes we're in the car on the train where we need help. Sometimes we're supporting someone else. Sometimes we're in that role where we need support. And I feel like I've been in all of those places. And it's so inspiring to me to see all the other panelists here and to see the people that turned out for this tonight. I run a local suicide and crisis hotline, and we also have a few other things we do that I'll mention. And whenever I'm feeling down about the state of the world, I go into our call room and I look up on the wall, and we have a wall of pictures of all of the volunteers, the people who have taken hours and hours and hours out of their lives to come and sit in a room at 2 a.m. and answer the phone in case somebody's in despair. And if I'm ever feeling down about the state of humanity, that restores it for me. I was pretty startled by the statistic around young people as well. I've got 7-year-old twin boys. And they're a handful. So I have a feeling that when they get to be teenagers, they're going to be needing all sorts of support. They're sweet kids. For me personally, this issue is very, very close to my heart. I've lost people close to me to suicide. I've had very close friends struggle with this. I've had to wrestle with whether I was the appropriate person to help them or not. And the thing that I want you to leave with tonight, or one of the many things, which you will, because there are so many wonderful things we have to share with you, is that when you are feeling alone in the world, think of the people that are up here and all the people behind them who want to have your back. It is very easy to feel alone. It is very easy to feel as though no one cares. And while this work can be, it can be heavy, and I'm sure that being here tonight, it's almost impossible for us to talk about this without it bringing up the things that we've gone through and the people that we've lost or the people that we're worried about. So if you leave here tonight and you need support and you need to talk, please make use of the resources available in our community and the national resources. There are a wealth of them, and sometimes it's just knowing where to turn. So pick one or call all of them and tell everyone until someone listens to you. I'll share with you just a little bit about our program so you're familiar with us. We serve Monterey County, Santa Cruz County, and San Benito County. We've been here for over 50 years. Sometimes people haven't heard of us, and that's okay. Sometimes you don't hear about these things until it's that moment where you really need it, and hopefully you can find it easily. Or hopefully someone close to you says, hey, I'm worried about you. Here's a number I think you should call. So we have a 24-hour suicide crisis line, and you don't have to be suicidal to call. You can call if you're having a bad day. You can call if you just need someone to talk to. If there's a thing that you don't feel like you can share with the people in your life, or you just need to get something off your chest, or you need to vent, we will be there. And it's answered 24 hours a day, and it's community-based. Volunteers from all across the Central Coast who dedicate their time and their lives to being there to support you. Because for most of them, at one point, somebody was there to support them, and they're paying it forward. Our line in our program is accredited through the American Association of Suicidology, which just means we work really, really hard to make sure that we're doing things in the best way possible. We're following what we call best practices. We're looking at the most current research on suicide prevention and making sure that everything we do is going to have the best possible outcome for the people who are calling us, because we owe that to them. We also are in the process of joining the National Suicide Prevention Lifeline right now, which is another great thing. And aside from that, and the 4 amazing staff and 70 amazing volunteers we are very active, like NAMI, in educating the community. We go into middle schools, high schools, sometimes even elementary schools, college courses. We go into businesses. We meet with human resources directors. We work with a lot of our local partner agencies. And together we try to educate one another. How do we help? What do we do? So that every single person in our community is prepared and feels that if they're presented with someone who might be feeling this way, that they can start that conversation. Not that you have to do it all yourself. I find that people who come to talks like this and people who show up for work like this, we tend to be the helpers. We're the ones who, we throw our hats in the ring and we want to be there to help. And I would encourage you, if you're that person in your circle and in your life, to know that you don't have to do it yourself either. We will have your back and we will be here to support you in navigating that. So I'm very proud of our outreach work in the community. We reach thousands and thousands of people each year through a variety of presentations and trainings to help people break the silence and talk about this more and have productive, healthy discussions around suicide prevention. And the things that tie us together. Sometimes when I talk with someone on the hotline and they're in despair, it's this feeling that they're drifting off into the atmosphere, and seeing somebody gain the skills to live through a suicidal crisis is one of the most amazing experiences of my life. And they're the ones doing the hard work. Picking up the phone is about 90% of the work for us. So being able to witness that gives me a lot of hope, and we see that happen on a daily basis. I'm also so grateful for our volunteers who help support our support groups for people who have lost loved ones to suicide. It's an experience I've had in my own life, and I can say it's different than losing someone to any other kind of death. And you deserve and absolutely can access specialized support for that. And I once heard someone say that, our goal is not to get over that loss. The pain never goes away because the love never goes away. And we learn to integrate that, and we learn how to move forward with that being a part of ourselves, but not having to carry that alone. So I have left a few of our program materials on the back table. Last thing, and then I'll pass it on because I'm a talker, which works well in my field of work, actually. This September 15th, September, as you might know, is Suicide Prevention Awareness Month. And for the last 12 years, we've hosted a walk down at Window on the Bay Park in Monterey called the Coastal Trail Walk. If you'd like to take a flyer and put it up somewhere in the community, or if you'd like to join us, we'd love to have you. And you're welcome to walk to raise awareness, or to walk in memory of someone that you've lost, or in support of those who are struggling. That everyone's welcome, kids, dogs, neighbors, tell anyone that you know about it, and we would love to have you. And feel free to call us. We're here 24 hours a day.
So my name is Kat Moore, and I'm a crisis text line counselor. I have cared about suicide since the age of 15 when I felt suicidal. And interestingly enough, I did contact a religious leader that helped counsel me. I became a Young Life volunteer 35 years ago, and I dealt with suicidal teenagers, and I'm very happy to say that one of my suicide survivors who did a pretty good job and was almost not here is now on the crisis text line platform as a crisis counselor. So what I would like to tell you is there has never been anything more rewarding than being a crisis text line counselor. And it has opened up doors for me, and it's healed me. I have 3 adult millennial sons, and I think with Bonnie, and enough was enough. I have dealt with so many losses. My oldest son lost 2 of his fraternity brothers. One hung himself. The other died of a drug overdose, which to my mind is just a different way of taking your life. In the last 10 months, we know of 8 different young people who have taken their life. And this is not counting all of the infamous people that have also taken their life. It's a really serious issue. As Bonnie said, it's an epidemic. And I am on the front lines, as you are as well. And so we hear the stories. And this reaches all walks of life. I have had a texter as young as 7 years old. I've had 10-year-olds. I've had 13-year-olds. And I want to also share with you that there is hope. Crisis Text Line was founded by Nancy Loveland. If you go home and you Google TED Talk, Crisis Text Line, there is an immense amount of information, so I'll try to save not being redundant, but please go and look at that. We need volunteers, and if you are hurting or in pain, there is no better way to heal than to help somebody else, especially because you know what it is like to lose someone. And Nancy Loveland founded this 5 years ago. We are growing faster than Facebook, sadly. We are now helping Facebook and have been working with them for the past 3 years. We have done over 60 million text communications. Nancy Loveland was the founder of Do Something Good, and she received a text message that he won't stop raping me. He's my father. And this was through Do Something Good, and she realized we need to create a way for these young people to communicate. They don't use the phone. And not to take anything away, we need both. We just discussed this. We need both. But young people are native texters. That's how they communicate. And I was laughing. We have a sense of humor too. My texting is not great. So one of the things is we have to really try very hard to spell everything correctly. And sometimes I'll have 5 different conversations going now. And so it's very critical that we communicate and we text. So that's a challenge for me. But so anyone that has good texting skills, so one of the things I wanted to say is we have a program for volunteers. First of all, we are free. We are 24/7. We are in 50 states. We just launched about 2 months ago into Canada. We're working with Prince William's Foundation, and we're launching into the UK. Our goal is to be international. I am also an ambassador for an organization called Project Echo, which I would also really encourage you all. Google the TED Talk on Project Echo. It is an amazing, disruptive, wonderful thing. We're working on over 100 different types of health issues, not just mental health, but mental health, opioid addiction, diabetes, HIV. We're working with prisons in Hep C, It's an amazing organization. We're now in 30, the organization that I work for, my day hat is I'm the director of marketing for North America for Adizes. And Dr. Adizes and our organization is very supportive of their employees working in the community. All of the work that we do for Project ECHO and for Crisis Text Line, I do pro bono. So these are unpaid things, but we're very supported by our company to do this because it's really critically important to do. We need volunteers. We currently have over, I think, 12,000 volunteers that have been trained. Less than 33% of the people make it through the whole process. It's a 30-hour training program. It helps you. You can do it in your PJs. And if you go online, you can learn more about it. You can pick the times. We just ask that you have a 1-year commitment for a minimum of 4 hours a week. I usually am on the platform from midnight till 3:30 in the morning on Friday nights and also on Sunday nights. But ever since Anthony Bourdain and Kate Spade took their life, we have gone from a queue of 40 people on a Friday night to we have over 260 people waiting in the queue. We're still very proud that we have less than a 5-minute response. So if you know anyone who is feeling suicidal, they can dial text 741-741-HELP, and within 5 minutes, someone will be on the line responding to them. I'd be happy to answer questions afterward. Like I said, we can tell you some of why are people suicidal, what's going on in their life. If you're a parent, please don't yell at your children. That's one of the ones that I hear a lot. And the other is the pressure of grades. Grades are a huge, huge issue, particularly when you have freshman kids that go off to college. And I think that rather than and the other part of it is a lot of boys in particular are not very good at communicating with their parents. And I cannot tell you how many boys have committed suicide from a broken heart relationship. And the other thing is we share all of our data. So if any of you are in the mental health, you can go online and we can tell you that Montana has the highest suicide rate. And we know that because they also have the highest guns per capita. So they have access to it. And as a crisis text line, what we do, counselor, is we do an assessment. We do 4 levels, and we try to gently do it. Do you have the ideation? Do you have the means? Do you have a plan? Do you have a time frame? And if all of those 4 things meet a criteria, we flag a supervisor who parallels our conversation. And our goal is we do not represent ourselves as therapists. We are there in a moment to be with someone that's going through a rough time. And we are trying to take them from a hot moment to a cool calm. We try to develop coping skills and a plan, a safety plan. And so, and our attitude is that you do not have to be suicidal. If it's a crisis to you, it's a crisis to us. If you're freaking out, if you're having anxiety, we deal with everything. Cutting, suicidal ideation, anxiety, depression, relationships. And we also have a wonderful toolbox, so if you're afraid, there's a lot of support and training. And I've never met a group of kinder, more wonderful human beings than the people that I've met that are crisis volunteers. So, if you know anyone who needs our services, please pass it on. And B, if you are interested in being a volunteer, we are desperately in need of getting people. And you can do this at home on your computer. You just need to have internet access and a computer, and you can do it in your PJs, and you can pick out any hours, and you can also hop on. And I'm also a level 3 counselor, and I'm now on something called the Spike team. So I do parachute in when our volume gets high. They'll send out messages to us, and I'll get on the crisis text line to help people. But again, I also want to acknowledge for anyone who has lost someone to suicide that I'm deeply sorry, and that you may be thinking, what could I have done differently? Please don't beat yourselves up. Mental illness is not your fault. And I think that's the hardest part. And I know I can feel I have a lot of empathy for you. I met a friend of mine who was my neighbor. I had 3 sons, she had 3 daughters, and I bumped into her and I wasn't aware, and her daughter had hung herself because she did not get into the grad school of her choice. And I felt this woman who we shared raising our kids, and she sobbed in my arms for 10 minutes. I don't ever want any of you to ever know or feel what that feels like, to lose someone. You feel so helpless, and it's beyond me, and it just is going on, and we all need to really take a little time and help each other and have a conversation. And when you're in a line somewhere, turn around and say hello to the person. We need to start looking people in the eyes and having conversations and knowing who our neighbors are. This is part of it. So I don't want to take up too much time, but thank you, and I would love to answer any questions you have afterward.
Guys, I want to acknowledge that this, even though we're trying to present this in a way that is hopeful, this can be incredibly triggering and very painful for a lot of people. So please do not hesitate to get up. Do not hesitate to walk out, to get fresh air. The library next door is lovely. The bathrooms are over here. Just please take care of yourself. There's snacks, there's water, but this is about you, okay? Thanks.
Thank you, and thanks for inviting us to be here today and for organizing this. I think this is awesome. I became involved with the American Foundation for Suicide Prevention after the loss of my husband, Scott, in 2013 to suicide. I attended my first survivor support group in Livernois after I moved out to California from Texas. That was in early 2014. I can tell you that was invaluable for me because the grief, as some of you may know, associated with suicide is a completely different experience from other types of grief that I had had. It's complicated by guilt, by trauma, and shock. So connecting with other people during that time who had experienced a similar tragedy was essential to my healing and introduced me to the work of AFSP. I want to give you a little background about the organization and the different branches of work that we focus on, and then talk about some of our local activities. The foundation was formed in 1987 by a group of survivors who had lost someone to suicide. They partnered with scientists, and the initial focus was on research to address a decades-long increase in youth suicide. It was the first nonprofit national organization dedicated to understanding and preventing suicide through research, education, and advocacy. And that's still the thrust of the organization today. The core strategies today include funding scientific research, educating the public about mental health and suicide prevention, advocating for public policies, and supporting survivors of suicide loss and those affected by suicide. AFSP is the largest private funder of suicide prevention research. Our grants have funded research in neurological, genetic, and psychosocial studies. And I'm from New Jersey and I talk fast, so if I need to slow down or you're not hearing me, just let me know. In 2017, 27 separate projects were underwritten by AFSP. The research grants have been acknowledged in a range of professional publications, and we contribute significant findings in multiple disciplines of study. These findings help to shape treatment approaches, deepen our understanding of the brain, and determine the most effective allocation of prevention resources. AFSP develops education programs that are informed by the outcomes of our research. These include programs in schools, communities, and workplaces. They provide training in mental health and suicide prevention. Some of our community-based programs include a program called Talk Saves Lives, and that's an introduction to suicide prevention. And it covers the scope of suicide, research, and what we can do to fight suicide. We have a college program called It's Real, College Students and Mental Health, and it's a documentary that features stories of 6 students who have, from across the country, who have struggled with suicidal ideation and depression. And these stories are of hope and healing and encourage others to reach out when need arises and also to help reduce the stigma of seeking treatment. The More Than Sad program is directed towards teenagers, and it helps them recognize signs of depression in themselves and others. It challenges the stigma surrounding depression and demystifies the treatment process. We also have a component that's geared for parents and teachers to also help them recognize the signs of mental health distress and access services. Recently, our Greater San Francisco Bay Area chapter sponsored a facilitator training program for group leaders to establish more survivor groups and enhance the services that we offer. Last month, we held a Stronger Communities LGBTQ Suicide Prevention Workshop in San Jose. That workshop was sold out. It was attended by many behavioral health providers in the area who serve this population, and it's a population that's greatly impacted by suicide. We also had an interactive screening program, ISP, and that connects individuals to mental health services, and it's customized to the venue where it's being utilized, whether it's a university or a workplace or a law enforcement program. And participants can engage with that service anonymously. They can get feedback from providers that are at that facility and direct them towards services without having to reveal themselves until they're ready to do that. It helps them, it's sort of an ease into a transition to getting mental health treatment. Many of these people would not have sought treatment otherwise, and the participants in that program are 3 times more likely to engage then in in-person services. Our advocacy branch, advocacy and public policy, we have efforts on the state and federal levels. Legislation includes mandating suicide prevention programs for schools and the Excellence in Mental Health Act, certifying community behavioral health centers. On the national level, we work to increase funding for the National Violent Death Reporting System, because as we're aware, suicide is often underreported because these programs are not fully funded, so deaths are categorized otherwise, and we're not getting real accurate data. We also have efforts, of course, for military and veteran suicide prevention. As Bonnie mentioned, I'm a social worker with the VA. We lose an average of 22 veterans a day to suicide. So that's something that's also on the forefront of the work of ASP. Each year, our representatives participate in the annual Advocacy Forum, and that's at the state capitol here in California, in Sacramento, and also in Washington, D.C. We meet with representatives from the area to address current initiatives or pending bills to promote mental health parity, prevention, and research. So lastly, our loss and healing branch, closest to my heart, provides support to those who have been affected by suicide. Our survivor outreach program is for the newly bereaved, and it connects people to trained AFSP survivors who will either meet with them face-to-face, by telephone, video chat, whatever the comfort level of the newly bereaved, just to offer some initial support and access to resources. The International Survivors of Suicide Loss Day, that's the event that Bonnie mentioned that comes every November. Those are gatherings that are held actually throughout the world. In 2017, we had 400 events in over 20 countries. Here in Marina, this year will be our 5th event. We have a screening of an AFSP-produced documentary that features families and commentary about the suicide loss experience. We have a keynote speaker, we have breakout sessions, and we have great food. So that's something, it's always the Saturday before American Thanksgiving, and that's because that was designated by Congress at the initiative of then Senator Harry Reid in 1999, having lost his own father to suicide in 1983. As we also mentioned, we have a monthly local support group We meet the second Saturday in Salinas, 1 to 3 p.m. There are flyers in the back, and you can certainly contact myself. JLivernois is our other co-facilitator for more information about that. It's an open group. You can drop in. You don't have to be there every month, when, whatever works. I would also encourage you to visit the website, afsp.org, just to get a little more information about the scope of programs that are available. Thank you.
Hi. My name is Watchman. I am also a volunteer for the AFSB support group. I wasn't sure exactly how I was going to approach this meeting tonight. So while this was going on, I thought I'd give you a different perspective, my perspective. I'm a retired nurse. I retired in 2014. I lost my son in October of 2014 by suicide. That day changed my life forever. I really did not understand why at the time, because my son had just graduated from Cal State University here in Monterey Bay with honors in the behavioral sciences. It's very difficult to explain a feeling of somebody that has been affected by suicide. I felt very lost, depressed. I'm also married. My wife has also been depressed. And so we were trying to reach out and see how we could be able to cope, because it was such a traumatic event. So we reached out and we got resources. I'm not exactly sure what site told us to go to, but believe it or not, we ended up right here in this building one day with Dawn. Dawn is my facilitator. So I'm happy that to report that we have been able to cope reasonably well. We will never be the same. My wife and I and my daughter will never be the same. But what I can say is that support groups are essential to people who have gone through an event like this. And I would highly encourage the group, if anybody knows or if you have been a part of a suicide, or that an event happened, to please reach out to a support group, because they do provide effective grief counseling. We are a small group currently. It fluctuates. There's different how would I say? There's different ways that we approach it. How would I say that? Different ways. Some of the suicides occurred in different ways, but the group together is a support group where we can talk openly and freely and not be judged. And that is, I really appreciate that. So, I'm very happy to be with this group. I continue to look forward to our monthly meetings, and I just want to say that if you all have any questions for me about me or my family, please feel to let me know.
I'm Dr. Hill, and as Bonnie introduced me, I'm a psychiatrist. I've been in the Monterey Peninsula area for about 9 years. Prior to that, solo private practice for about 20 years. Okay. And I thought that I would just share a little bit about my practice experience so that you'd understand some of my comments that I'll make a little bit later. I have worked in all areas of psychiatry. I've worked in child and adolescent psychiatry. I've done geriatric psychiatry, so I've seen people, I've had patients 100 years old. And I always tell people, you know, if you have a brain, things can go wrong with it, just like with your heart and your lungs. People are afraid of acknowledging when they're not thinking clearly or they're having mood problems. And so I try to normalize that could happen to anybody and make people feel comfortable about asking for help. And with the experience that I've had, I've treated 4-year-old twins, identical twin brothers, for bipolar disorder. I've had people who were in their early 20s look at me bug-eyed when I would tell them, you don't have to live with suicidal ideation. They've had it since they were 3 or 4 years old and never imagined that that would stop. And the goal of the treatment is to normalize their mood, and that would include not having suicidal thinking. So I've seen a lot of things. My responsibilities as a psychiatrist are, and in doing hospital work, I have the responsibility of taking care of people when they've already attempted suicide, or we have assessed that there's a high risk that they're going to suicide. And so the job then is to figure out why and do something about the why. And that's that could go on forever talking about how to help somebody, but I think the thing that's important, am I bumping something that I shouldn't?
Go ahead and use the other mic.
Oh, the awkward whole thing, okay. That's weird. So the thing that I would say as a kind of a unifying point of the comments that have already been made, but also what I've observed over the years, is the people who do suicide are the people who believe and feel disconnected from community. They believe they can't be reconnected to community. And and for me, if I know that I am helping somebody to feel connected to community, we're going to have a success. Doesn't matter what the medication is, doesn't matter how many times a week they're seeing a therapist. Helping somebody to feel connected to community is the most important, I think, the most important thing to prevent a suicide act, no matter how young or how old somebody is. The other comment that I want to make is regarding the increased occurrence of suicide. So the biggest frustration that I have is getting people to believe that the illness that we're identifying is very serious. Whether it's family, the person that I'm working with, or administrative people, insurance company administrators. My significant example of that experience is I think it was the Monday or the Tuesday after Memorial Day. I spent 5 hours in a deposition testimony in San Jose about a situation where I chose to treat somebody, and the insurance company did not want to pay for the person's treatment. We have to do that almost every day. Very frustrating, very time consuming. let alone having the person that needs to be helped understanding that they need to be treated. So I think that has contributed to people not getting help when they need to get help, because I've had people tell me, well, if the insurance company says I only need to be here for 3 or 4 days, then I must be okay, right? I've had people tell me that. The other significant thing that has happened is the insurance industry, again, influencing care with people then believing that the specialist is not important. The primary care doctor can do this, and they can't. When we train, we go to medical school, we all graduate from medical school, MD, physician, and then we pick a specialty. And a psychiatrist has to, in their specialty training, do neurology and internal medicine. Family practice and internal medicine don't do any psychiatry in their residency training, okay? So they don't have the experience or the education really to treat these serious problems. But the insurance companies have said anybody can treat depression, okay? Then we have this study that happened, I don't remember the year, sometime I think in the 1990s in Great Britain. The study was about a question in terms of treating depression. The study happened to have a lot of teenagers, and one of the conclusions the researchers made was that a particular antidepressant would, in teenagers, increase suicidal thinking. So the FDA decided that they were going to label all antidepressants as creating a risk to suicide. What happened was then doctors responded to that and they stopped treating and or took people off of their medications. And when you actually look at the studies that look at suicide rate actually went up after doctors stopped prescribing. So there are lots of things that influence whether or not people get treatment that have then affected the rate of suicide, including people just being afraid to ask for help and being afraid to receive the help. And I think that would be all I want to say about that right now. I'm certainly open to questions, and I think we're going to do that after everybody speaks.
So hello, I'm Dana Edgell, as Bonnie mentioned, and it's my pleasure to be here with you tonight. I work for Monterey County Behavioral Health, and I've been a licensed clinical social worker for quite some time. I've worked a lot with children, youth, and families. And in January of this year, I was very excited to move into the role of prevention manager, which please don't ask me what that actually means because we're still trying to figure it out, but it's giving me an opportunity to come and be present at community events and focus on community education. And the very first day that I was to start my new job, so I was walking out the door with my car keys and my coffee and my phone's ringing, and I answer the phone, and it's one of my family members telling me that one of our family members is in the ICU and has had a very serious suicide attempt. So that morning, it was just early January, so it's still a little with me. And as I was reflecting on what I wanted to share with everyone today, one of the gifts that I received in that moment was being a part of behavioral health, being able to call my employer and say, this is supposed to be my first day of work, but I'm not coming in today. I don't know when I'm going to be back, and I had absolute support for that. So on the positive side, my family members survived, but we spent some time up at Stanford and and accessing care and treatment. And so that's hopeful and positive, but I really wanted to just put that out there so that we can all be thinking about our coworkers, people that we connect with. Many of us are having experiences like this, and just what a gift that was when I could call my boss and say that. And then the other part of the conversation is kind of the immediate shame that happens, feeling like, why didn't we see anything? Why didn't we notice? Why didn't we see any signs? Because it just really hit us kind of out of the blue. And what she said to me also is very reassuring, is that nobody is immune. And so I'm here today being present with you all at this time when there really needs to be a change in so many things. And I'm so grateful to meet folks here. Carly and I met today, and Monterey County Behavioral Health has partnership with Suicide Prevention Services of the Central Coast. And I'm very happy to have more relationships and really look forward to creating more community conversations and to bring information out to everyone. We really need to be able to learn how to have conversations, and some of that is just the practicing of how do we ask someone, are you feeling suicidal? I still remember the first time that I had to have that conversation, and it felt weird. It felt like, I can't ask somebody this, it's so personal. I was working in the mental health field actually at community hospital, and one of my clients was going out for a pass, and I had to assess whether or not this young person was suicidal and if she was safe. But so I had my bachelor's in psychology, and even though I had background in training, just to be able to be comfortable saying to somebody, are you feeling suicidal, was new for me. Now I'm much better at it, and for example, my stepdaughter just had a baby, and I'm also very passionate about maternal mental health issues, and so I'm checking in with her. How are you feeling? You know, are you depressed? She has had anxiety and has been psychiatrically hospitalized, so I know she's more at risk. So we were able to have that conversation. So I think being here today, I want us to think together about how do we help one another to become more comfortable having these conversations. And I really love the resources and the message that we're not in it alone, that if you're the person that's reaching out and offering help and support, that you don't have to have all the answers, and really none of us do, but knowing where to go and having those resources, I think is really key and critical. So in terms of behavioral health services, so Monterey County Behavioral Health has clinics throughout Monterey County. I have some brochures on the back. We have a centralized now call center, and so those folks are bilingual. They're trained to be able to direct people to the right place to go to get an assessment, and then link to care. We're very proud to get to partner with Suicide Services of the Central Coast, and we're really encouraging people more and more to call that number, to reach out and get help. So I think that's all I'm going to say about our services for now, and again, I'm here for questions and have some information and resources.
Well, good evening. It's really, as Dane would say, oh, this mic. I'm not going to do that. Yeah. As Dana was saying, it's a pleasure, really a pleasure to be here to open the conversation in community so that we can break down the stigma that there has been for many, many years of not just mental illness, but especially acutely with suicide and the uptick of suicidal, people attempting suicide and completion of that and so on. My own story is a very detailed and long one, as I'm sure many people have their own stories that are detailed and long. But to kind of sum it up, I've had mental health issues since I was a child, and they weren't really listened to when I was a child. It was kind of, who do you even talk to about that? As I got older, I mean, I was in my first psychiatric hospitalization when I was 14 years old. And at that time, I grew up in Los Angeles, and at that time there were no children's mental health facilities. So I was put into a locked psychiatric facility for adults, and I was the only child there. And talk about it being horrifying. It was terribly horrifying. So, as Bonnie said, a lot of things that have happened to me, most people wouldn't, be here. I give away my age. I'll be 61 next month. I never expected to make it to 25 or especially not 30. But but here I am. So the acute things that can happen that can cause symptoms of PTSD or other kinds of acute depression, I've had so many traumatic experiences that they led up to my attempting suicide first when I was probably 15 years old. I was also put into a residential treatment facility for troubled kids who had mental illness, and I was there, for 3 years. That's a whole other story, but I was kept there until I was of legal age that I could go out of there. And there wasn't a lot of follow-up with how am I going to cope in the community once I've been institutionalized for all these years. So those are also factors. Moving along, I was able, by some, I think, the grace of God, to have completed my bachelor's degree. I had, like someone else was talking about the child or someone with honors, I had that. I had honors in college. I won teaching awards when I was in graduate school. I went to graduate school. I moved on. I got out of, the horrid things that had happened to me, only to be, I'm going to kind of fast forward here, only to meet a psychiatrist in 1992 who entered in, shortly after starting with him, who entered into an inappropriate relationship with me, I guess is the only way I can put that. I didn't know what was happening to me until it was really too late, and I was being brainwashed. And he gave me, for instance, many meds, an enormous amount of meds, not therapeutically, but it was almost like he was asking me to overdose sometimes. I wondered, because the counts and amounts later, I will get ahead of this, but my attorney who I worked with to sue him for medical malpractice and won the case, miraculously, said that the counts and amounts were the term that the attorney used were unbelievable. So I did have a number of suicide attempts through those years that I was seeing him as my psychiatrist, but I was also having a romantic relationship with him at the same time. But things like that can alter, I didn't think that I could survive without him. I didn't think I could go on. I didn't think I could cope without him. And so that led to a 10-year span of being there with him. I was still very depressed. I didn't say this, but I was diagnosed with bipolar disorder during that time. And yet, I don't blame him completely for the kinds of medication that he gave me, because today we have different medications and somewhat more effective medications to target different things in our brain chemistry that allow us to feel better, and to stop some of the very severe depression that can come along with bipolar disorder or with major depressive disorder. So at any rate, I didn't know what to do and how to escape this. But I am working on a book right now. It's taking me a while. And I want to read a segment of that to you, if that would be okay with you. Yeah. The book title is The Bipolar Mistress. And I'm going to read from this chapter. Before the sun came up, I was still very depressed and agitated. The darkness that I felt was excruciating. It was as though someone was trying to crush my soul, to rob me of feeling whole, and leave me exhausted. My apartment was lonely, was barren of hope, and devoid of feeling. I eyed the bottle of pills that sat on my dresser. It was a bottle of Vicodin, untouched. I was crazed, and all around me felt just like the world was falling apart. It occurred to me that I needed to have, and his name was Michael, that I needed to have Mike at a time like this. He set it up so that I would be dependent on him and unable to get through any emotional struggles without him. I decided right then and there that I would rather die than be continually looking for his approval. It was irrational, but it felt very real and very scary. I swallowed about 2 handfuls of Vicodin and got into my car. leaving behind all of my belongings and, of course, my precious cat, Wolfie. It was late, about 2 a.m., when I decided that I had better get myself on the road to Mike's office in Santa Barbara. This time I was living in Long Beach, if anyone knows Southern California. So we're talking about a little bit over 100 miles between Long Beach and Santa Barbara. It was, let's see, I might arrive there dead, but at least he would know how tormented I was. The night was crisp for a July evening. My car was almost completely full of gas, and I couldn't be missed, and I wouldn't be missed by anyone, or so I believed. Sliding behind the wheel of my vehicle, I could tell that I was nearing passing out. I put my hands on both sides of the steering wheel, pressed the keys into the ignition, and depressed the gas pedal. I had done it a million times before. I knew my car, and as I approached the 405 freeway in Long Beach, I could see the long stretches of lights lining the highway. This town was hell to me. I couldn't wait to get out, even if it meant dying to do so. Lights flashed on all sides of me, and the night sky was clear. I coasted down the middle lane, then swerved. I moved the car into the fast lane. It was about 2:45 a.m., and I was feeling very shaky. My breathing was labored, and my eyes were almost closing. There were hardly any other drivers on that stretch of LA freeway. Thankfully, there were no cops either. I nudged my car forward and started to gain more speed, while physiologically, my body had other ideas. Grasping at the steering wheel, I just kept looking straight ahead. I must die now. Nothing I do in this life will ever be worth it. I'm a failure, a complete mess. I can't even be with Mike, the only person in the world who really understands me. He was in his beautiful Santa Barbara home, ostensibly without a care in the world. How could he be peacefully sleeping while I was trying to kill myself? I didn't understand why he couldn't just rush into my arms and make all the pain go away. I kept driving and thinking and breathing. I felt like I was sliding away into the night. As I approached the coastline that led from Ventura to Santa Barbara, I felt extremely free and very, very drowsy at the same time. My mind was fracturing out of control, and the Vicodin was taking over. All of a sudden, my arms lifted from the steering wheel. My foot seemed to slide off the gas, but the car kept moving in a forward direction, never losing speed, but definitely being driven for me. It was all out of my control now. In looking back at that incident, I know that I was being watched out for. Call it God, call it divine intervention. Someone was making sure that my vehicle would arrive at Mike's office safely and with me in one piece. I don't remember the rest of my car ride, only that my car seemed to drive itself all the way into downtown Santa Barbara, past Cottage Hospital, and into Mike's office parking lot. The next thing that I do remember is that I was unpacking my bag in his suite of offices, and that I somehow found a blanket, covered myself with it, and slept the rest of the night and the rest of the next morning. When Mike arrived at his office on that Saturday morning, I was sprawled out on one of his couches, unable to pull myself together. I was shivering. I was shaking. I kept rocking back and forth. It seemed otherworldly, but I had survived this very serious suicide attempt. Now he was here attending to me, but he didn't once offer to take me to the hospital ER that was less than a block away. He said that we would take care of it together. Excuse me one moment. So I hope that in reading you that, you get an idea of some of the thinking that someone who is feeling acutely suicidal goes through. Now, it's of course not the same for everyone, but I was able, I think, to capture that kind of desperation that happens. And you know, there is hope, as has been said before. There is healing and there is hope. I wouldn't be here if there wasn't. But I have had any number of suicide attempts, and very serious ones. There was another one that I had actually a number of years before this one, where I ended up vomiting. Probably, it saved my life, but I had overdosed on pills. And I was going to have my last meal. This was in a hotel in Santa Barbara, where Mike and I had just spent the whole day together. And he left abruptly, and I, was falling apart. And I took this bottle of pills and I was absolutely sure that this was it. And so I ordered what I thought would be my last supper. I ordered from the hotel, dining, whatever they call room service. So room service came, I had this meal, and luckily for me, I ended up throwing up profuse amounts of vomit into the toilet and over and over and over again. I still was very sick, but I survived it. Obviously, I'm here. So the fact is that those of us who have had very difficult lives, or even difficult lives for a short period of time, but feel desperate enough to want to take our lives, there is hope on the other side. One of the things that has helped for me, people have asked me this over time, is, and Bonnie knows this, we've talked a lot about this, is my faith community, is my spirituality. What ended up happening after this happened, and then a number of other things happened, is I moved up to Northern California. There were a lot of other factors, but I started to rebuild my life. And it was slow, it was difficult, it was painful, it was not without tremendous additional pain. My parents didn't understand this. They were still alive at that point. And so there was a level of, I think, my mother, of frustration that, she didn't know what to do and she couldn't really do anything for me. So I survived it by myself with help, and often not the correct kind of help, such as with Mike. But in addition to that, often I had therapists who also weren't particularly skilled in trying to get someone like myself through this experience. I will break my anonymity and HIPAA rules tonight, and I will tell you that Dr. Renee Hill is my psychiatrist. And I am forever grateful to her, because she is a psychiatrist who's been, in terms of the utmost of professional stature, she is that for sure. But she also was the only one in all these years who was able to get me onto a medication which has literally stopped the suicidal feelings and the suicidal ideation. And I remember when I was first put on this medication, I was telling her, and I've told others, it's like a door comes down in my brain, like a large garage door type of thing, and it stops the suicidal feelings and thoughts from getting through it. So they're stopped, they can't get through. So at any rate, that's where I'm at. I have some very good things to look forward to. I'm with a partner now that I've been with for almost 17 years, I can't believe it, and we're getting married in October. And my life is actually looking very good. I still struggle with depression. I still struggle sometimes, but rarely, with suicidal ideation. But as I said, there is hope. We've heard about that kind of hope, and I think you need to understand that there are resources out there. You see them here today. You have things on the tables to pick up. There are resources. So I'm so glad that you've listened to me tonight on this, and I hope that I've given you some insight into what it can feel like for at least one individual who's been suicidal and had an attempt that wasn't successful. Thank you.
Thank you, everyone, very much. Okay, we are going to, let me give you just a little bit of a run of the rest of the night. Our program is going to run until about 7:40. Our program is going to run until about 7. Okay, the program is going to run until about 7:45. The library is going to be closing at 8 o'clock, so at about 7:45 I'm going to wrap it up, and there'll be some time to chat afterwards. So we have about 20 minutes now for some question and answer, or even just some of your thoughts. Again, the intention here was for this to be a discussion. So please feel free to share at any level.
I do have a question for the doctor. When it comes to young adults, a lot of times you hear that they're having the feelings they are of depression. You'll hear a lot say, well, there's an age, if they make it to 26, things change as far as physically, mentally, psychologically. Do you have a comment on that?
Have you heard that before, or is that something you promote?
Well, I think that is, may not be right, but I think that is about the research on brain development, and that actually the brain is changing and growing and still being pruned. That's one of the terms we use, because when you're born, there are lots of tracts and cells that we don't really need, and as we mature, things get pruned into a healthier brain, for lack of a better word. So, you know, the maturity, that's about maturity, okay? That is not about mental illness, okay? So there are certain illnesses that start early in life and actually become very symptomatic as people are entering early adulthood. So I think that's the way you're asking the question is a different issue than what you're understanding about that. Okay.
And a lot of that's come from psychologists that have made that statement that the brain changes, and 26 seems to be the magic number. And it's very concerning because it's kind of like, okay, wait till they're 26, they'll be okay.
No,
And,
that is not accurate.
I would imagine that, but hear it a lot.
Right. And again, that's from our history, and it takes a good 100 years for cultures to change their beliefs, okay? We still believe that mental illness does not happen in children, okay? So that information is being misused to say, well, they'll outgrow it. And that's not what's going to happen if somebody really has a mental illness. It needs to be treated. And the good news is if you treat early, there are fewer complications earlier. And there is some data that if there are fewer complications later, and there is some data that we hope if we treat early enough, people actually will not have a continuation of the illness as adults. Okay.
And I won't take up much more time, but you made a statement that also as parents dealing with the issues of adolescence, about the brain is no different than any other part of your body that has an ailment, and society just doesn't recognize it that way. They'll say things like, you know, if you get a job, you'll be better. You know, go out and take a walk in the park. Anyway, thank you there's two things you said, and that was one of them that really hit home.
Right. I mean, it's not that those things don't help. I want
Right.
people to exercise and take walks, but if you have an illness, you need to take care of that illness.
Definitely.
Yeah.
Okay. I want to thank you for sharing, and I just want to ask you, did you bring your violin?
Thank you, I think you can hear me. Thank you for asking, but I almost wish I had. Anyone else?
For Dr. Hill. So Dr. Hill, you mentioned about the study that was done. My question to you is, do all antipsychotic medications cause suicide ideations?
We're talking actually specifically about antidepressants, okay, which is a different category than antipsychotics.
Yeah.
And so here's how I will explain the issue of, first of all, needing a specialist to treat and understanding that data, that information. When I trained, it was prior to Prozac being available on the market. We had a couple of other families of antidepressants that we prescribed because that's what was available. And what I was taught was whatever medicine I prescribed, I needed to monitor an individual more closely in the first 2 to 3 weeks of treatment, because we could not predict what symptoms would get better first. So if you had a person who was very low energy, very low motivation, poor concentration, they really couldn't plan anything, and you start them on a medication, and maybe their energy gets better first, maybe they're thinking a little more clearly, but they're still suicidal. You want to catch that. That had nothing to do with the medication. It had to do with the progression of response. And I have had people, what I'll tell people is getting better is not a straight line. It's going to be like this. You're going to have days where you feel better and days where you feel worse. And sometimes in a person who's had treatment and they've been on several different medications and they have a bad day, and they're depressed still, they're thinking, oh no, nothing is ever going to help me. And that might be the impetus for them to act on their suicidal thinking. So I try to warn people about that possibility. That does not mean that you're not going to get better. Move forward, and Prozac came out on the market. Now the good thing about that medication in particular and the family of medicines, they were very safe relative to the medicines that we had before, which were the tricyclic antidepressants and the MAO inhibitors, and we had to be really careful. There was a fine line of toxicity versus benefit. So with a Prozac type of antidepressant, we didn't have those safety concerns, which was a good thing, because we could dose people to actually get them 100% better. But the bad thing was that was also when it coincided with the HMOs coming out and the insurance industry saying, oh, just see your primary care doctor, they can treat your depression. And what did they do? They'd say, well, come back in a month. You're not going to be better for a month, so come back in a month. They didn't have that information to monitor people appropriately in that process of improvement. So I've had one person that I would say actually insisted that their first suicidal thought happened after they were started on a particular antidepressant. I've never had a patient tell me that their suicidal thinking started after their antidepressant therapy started.
Oh, that's all right.
What also can happen is people not admitting, even when I ask them, they haven't admitted it. And it's not until they become comfortable talking about it that I will get that information. So I will say that I've never had a patient become suicidal in response to a medication.
Thank you. Can I ask?
I want to reinforce how important it is that you go to a specialist and you don't go to a primary care physician. And I'm going to bring something up, and you may not like it, but there is a very dirty little secret that everybody needs to know if you have high school or college-age kids. And I have a son who had a prescription for Adderall. In retrospect, for me personally, I regret having him put on it, because I do not believe that the physician that we were using, and he was a specialist, but in the past 10 years, there has been a rampant prescription craziness going on that I feel has caused a lot of problems. And so there is a black market for Adderall in colleges, and the problem is you have a lot of your kids who are in college and they don't have mental illness, but they're buying pills at $10 to $20 to $30 a pill so they can study and stay up all night. And so you have people that aren't even necessarily mentally ill, but because they're taking medications that they have no business taking, it's creating situational suicidal ideation that they should not be taking. And so I think it's it's an imperative that if you have kids in college, that you make sure that they are going to a specialist and you are really staying on top of it, because I cannot tell you, it it is the dirty little secret, and it is a black market, and you think, not my child, yes, your child. And so people need to be extremely careful about what medications your kids are taking and keeping track of what's going on with it, because it is in every single college. And I have 3 kids that have gone through college, and I mentor a lot of young people, and they tell me what's going on, and it is not good.
Hi, my question is actually to anybody in the panel. I'm not sure if anybody knows of an organization that helps parents when a child is either, it can be at any point after the age of 18, that there's nothing I can do, for example, as a parent, to make my son or my daughter go to a specialist, even the doctor, because they're 18. And at that point, you feel that it can be, I'm thinking even between 18 and 26, because that's when we can at least carry their insurance, right? Still. So is there any association that you can go to and say, my child used to go to the doctor, and you can't do anything at that age to make them go, to figure out what they have, to get it diagnosed, and that to me is it's frustrating. So is there anything that can be done? Because that's when it starts. I mean, not that when it starts, but that's when it's very noticeable when you can't do anything. And it's just, I was wondering if there's any help out there.
I've had family go to nanny meetings, support group meetings, and it doesn't matter how old the person is. You know, I've had people 50 years old refusing to be treated, and the family felt that it was very helpful to go to the nanny support groups, because when they learned how to communicate in a way that the family member became receptive to going in for help.
Can you all hear her? Can you in the back hear her?
I was just saying, I've had, when I have a situation where an individual who needs help is refusing help, I've actually recommended that their family go to the nanny support group for family. And the family members have been happy with that, and eventually they were able to communicate in a way that the person that we were needing to help did accept that they needed to go to treatment.
So when you have like an emergency, what is she doing? Where is it?
Well, if it's a real emergency, theoretically, you're supposed to be able to call the police, and they will do an assessment and determine if the person can be taken to the hospital against their will.
Until they actually try to do it.
Well, that's why I said theoretically, okay? And that's a community issue, because I've worked in other places and it does not work that way. And I've had other situations where I've had family come to me and describe a concern, and I was able to just take care of getting the person into the hospital, somebody that I didn't even know, okay?
There's no like association that can help you even through legal process, that you can take control over that person and make them
Not emergently, not in an emergency.
And not in the state of California.
It's probably one of the more frustrating situations for our parents. So for Monterey County Behavioral Health, we also have free family support groups. So I have flyers in the back. So we have them in Salinas, Marina, Soledad, and King City. And we're starting one in Salinas for parents of young adults, because that is a particularly challenging age. And then if you do you're concerned there's a psychiatric emergency, when you call and ask for law enforcement, please also ask for a crisis intervention trained or a CIT trained officer. Monterey County is really proactive in training law enforcement. I think they go through like a 40-hour training, and so there's a little bit more sensitivity and understanding in with those officers. There are legal processes, but it takes a while, and there usually has to be multiple repeat psychiatric hospitalizations that are demonstrating that that person can't really care for themselves. And also, as I see hands going up, so I'm going to walk over, give you folks a chance to say something, because they may have some other thoughts and resources.
I
I was just going to say that it's a conservatorship that you're talking about. I'm a paralegal in family law, and so I just wanted to give you that. That's the legal process. It's very difficult. You have to prove that there is beyond a reasonable doubt that person cannot care for themselves, which means that there may be a lot of long-term issues that they've struggled with, and you have to prove that. So that is actually a very serious issue in the legal field for people, unfortunately, that are young adults, because at 18, you know, you're not fully grown and developed yet. But yeah, it is an issue that I'm also looking into, and I'm here today to learn more about the issue because that's something that I'm more interested in.
I saw some other hands going up.
Oh, I have more on that.
Okay, so.
We've got time for 2 more questions.
Sure. So just to address the situation with having a young adult family member, 18 and older, I've lived that. And I can say that it is a very grueling process. She had 22 hospitalizations in Monterey County alone until they finally conserved her through Monterey Behavioral Health. I will not say that it was a bright, shiny time in my life. But there is hope. And the hope is NAMI, for sure. The family support groups, the individuals up here on this panel, the volunteers, everyone who's here. Without these people and this advocacy, I wouldn't be here. And my loved one would not be a successful college student like she is today. She was conserved for 2.5 years in a locked facility. I used to go and see her every month and travel 3 hours. And then began the process of bringing her back home, and that was not fun either. But there is hope, and that is working with the people that you see here tonight. Thank you.
We have time for one more.
Hi, I'm Ryan Speed. I'm with Mobile Crisis here in the Peninsula region. So I'm also part of Monterey County Behavioral Health. So along the lines of also asking for a CIT trained officer, you can also ask for a mobile crisis worker. They will know our schedule. They'll know if we're available or not, because we may or may not be out on another call. But we have a person, I'm out here on the peninsula. We have someone in Salinas Valley, and then we have someone out in South County as well. So we're all over the place, and we are available Wednesday through Saturday, 12:30 to 10, and every other Tuesday, 1:30 to 10.
Okay, so is there anything else?
Can I just say one other thing?
Yeah.
One of the other things that we've noticed, a lot of our texters will tell us for the first time something that they've never shared with anyone else. We have a lot of LGBT issues, and we also have a lot of incest and rape that has gone unreported. And so I think it's really important to understand that that might be at the bottom of this. So it's not necessarily so much mental illness as it is a situational thing that has created that. And I know, I don't know if you handle rape, but I know Robin DeFelipe is she's in the back. She's a rape crisis counselor, but she's also in private practice, and she's the person that I would refer anyone to that has any sexual abuse issues. She's fantastic.
And I said.
She seconds it.
No need to drop the mic.
I second that. That's who I said as well.
So I want to thank you all for coming. I want to thank you very much. I hope that you have gleaned some things here. I hope that you walk out of here with a folder full of good resources and phone numbers and names. If I could have the people on the board of NAMI stand up. There's a number of us here that are on the board of NAMI. Thanks, you guys. And then also, I want to thank 2 of the gals that work for us, Dee and Sylvia. So if anyone has any questions about NAMI or anything we have to offer, please feel free to reach out to one of us before you go. There also are the evaluations that I know Jayanti would like you to fill out. Should we pass those out? So if you would be willing to do that before you go, that would be incredibly helpful. And I just want to thank all the panelists. Thank you for coming out on Wednesday night after a night of work. And thank you all for coming.